Knee pain is a common complaint among adults and is most often associated with general wear and tear from daily activities like walking, bending, standing, and lifting. Athletes who run or play sports that involve jumping or quick pivoting are also more likely to experience knee pain and problems. Knee pain can often be treated at home, and you should start to feel better after a few days. But whether an individual's knee pain is caused by aging or injury can be a nuisance and even debilitating in some circumstances. Can knee pain heal on its own? Most minor knee injuries like strains and minor sprains heal on their own with conservative treatment. The prognosis for these types of injuries is good. On the other hand, ligament or cartilage injuries that lead to dysfunction or instability of the knee may require surgery. How do I know if my knee pain is serious? The location and severity of knee pain may vary, depending on the cause of the problem. Signs and symptoms that sometimes accompany knee pain include 1. Swelling and stiffness. 2. Redness and warmth to the touch. 3. Weakness or instability. 4. Popping or crunching noises. 5. Inability to fully straighten the knee. How can I get rid of my knee pain? 1. Weight management. Carrying extra body weight makes it more likely that you will get joint pain in the first place. If you have joint pain already, being overweight can make it worse. Losing even a small amount of weight can make a big difference to knee pain. 2. Heat, ice packs. Heat is an effective and safe treatment for most aches and pains. You could use a wheat bag, heat pads, deep heat cream, hot water bottle, or a heat lamp. Many people find that ice is helpful when used to manage short-term knee pain. Ice packs can be made from ice cubes placed in a plastic bag or wet tea towel. You could also use a bag of frozen peas or buy a ready-made pack from a pharmacy. 3. Suitable footwear. Examples include sensible shoes and arch supports if you have flat feet. 4. Get strong, stay flexible. Weak muscles are a leading cause of knee injuries. You'll benefit from building up your quadriceps and hamstrings, the muscles on the front and back of your thighs that help support your knees. Balance and stability training helps the muscles around your knees work together more effectively. What are the best knee pain relief exercises? Anyone with severe knee pain should consult a doctor before trying to exercise. It is best to warm up with light exercise before starting any knee strengthening exercises. Examples of gentle exercise include walking, cycling, and using an elliptical machine, which put minimal stress on the knees. Recumbent exercise bikes are often thought to be one of the best exercise equipment options for bad knees because they feature a reclined seated position that reduces the weight load and impact on the knees. Are squats bad for your knees? Squats aren't bad for your knees. In fact, when done properly, they are really beneficial for knee health. If you're new to squatting or have previously had an injury, it's always a good idea to have an expert check your technique. Is climbing stairs bad for knees? Climbing and descending stairs are challenging for people with knee arthritis. Arthritis causes degeneration of the cartilage that cushions the knee joint. Without protective cushioning, the act of climbing stairs becomes uncomfortable. Can you walk with no cartilage in your knee? If left untreated, the joint, especially weight-bearing, such as the knee, can eventually become so damaged that the person cannot walk. Apart from immobility, the pain may slowly get worse. All small articular cartilage defects can eventually progress to osteoarthritis if given enough time. How should I sleep having knee pain? To help find a comfortable sleep position, try using a pillow to support the painful parts. You can put the pillow between your knees if you sleep on your side, under your knees if you sleep on your back. Bottom line: knee pain is a common problem but, at the same time, preventable. Make sure you take care of your knees and follow a weekly exercise routine to strengthen the muscles around them and keep a healthy weight to support it. Small changes provide great results.